Well, thank you very much, Mr. Chairman. And while you still have a few months left, as well as a few more hearings, I do want to start off by saluting you for your many years of service to this country, including as Senator and Chairman of this committee. I know my Democratic colleagues and I will miss you next year. On the topic of today's hearing, Mr. Chairman, our country is in the middle of a painful crisis. The COVID-19 pandemic has crowded hospital intensive care units, it's emptied schools, it's shuttered businesses. It has deepened damaging health disparities among Black, Latino, and tribal communities, people with low incomes, and people with disabilities. It has ravaged prisons and nursing homes and other congregate care facilities. It has strained our economy, our mental health, and a lot more. It has claimed around 190,000 lives so far and more each day. Unfortunately, instead of leading us in the war against this virus and fighting the pandemic, President Trump is fighting public health experts. Instead of supporting facts and science, he is supporting conspiracies. He has spread absurd, false theories about FDA officials being deep state agents and CDC overstating the death toll. He has promoted unproven treatments and junk science. He's called for less testing, which he blamed for the rising number of COVID-19 cases, wrongly claimed kids aren't likely to get or transmit the virus, and has repeatedly insisted this will just all go away. The list of inaccuracies and outright lies at a time when truth is a matter and life and death goes on and on. And unfortunately, President Trump is not alone in his deeply flawed response. In July, after months of delay and inaction, Republicans put forward a proposal that didn't even come close to addressing the harsh realities of this pandemic. Now we are hearing their new plan is to force a vote on a proposal that does even less. I hope instead that Republicans will sit down with Democrats to work on a package that helps our economy and keeps our American families safe. A package that actually increases testing and access to healthcare, that actually supports our schools and addresses the childcare crisis and actually protects workers. And most relevant to this hearing today, helps make sure we get safe, effective, trusted vaccines that are widely and equitably distributed and administered. Vaccines have long been a critical public health tool, and even before this crisis, it was important that we encourage uptake of flu vaccines each year to keep people safe, to make sure vaccines are available and administered to kids across the nation, including through efforts like the Vaccines for Children program, and build vaccine confidence while combating misinformation. But this pandemic has made these challenges more urgent than ever. So I'm glad we do have Surgeon General Dr. Adams and NIH Director Dr. Collins here today to share their expertise. But I'm also frustrated that despite my request to the chairman, FDA Commissioner Dr. Hahn and CDC Director Dr. Redfield were not invited to testify today. Those agencies play a very critical role in developing and distributing vaccines and should be here today. Hearing from them is even more urgent in light of recent political interference. By waiting to bring them before the committee, we are losing valuable time to avoid costly mistakes. In the past few weeks, we've not only watched President Trump directly promote conspiracies about FDA and CDC, we've also seen reports that he exerted political pressure on FDA to issue an emergency use authorization for convalescent plasma, and on CDC, which changed testing guidelines to be more restrictive with no justification and running counter to the consensus of public health experts from across the country. And these aren't the first reports of political interference. The Trump administration has previously promoted unproven treatments like hydroxychloroquine and blocked CDC guidance for community reopening. Recently, FDA Commissioner Hahn announced he was prepared to authorize a COVID-19 vaccine before phase 3 trials were complete, but without providing any guidance about when that would be appropriate. When it comes to a COVID-19 vaccine, we cannot allow President Trump to repeat his alarming pattern of putting politics ahead of science and public health. FDA scientists' efforts to ensure the safety and efficacy of vaccines must not be undermined by political meddling. CDC's role in distributing a vaccine and prioritizing who receives the first doses must not be supplanted by politicians or campaign strategists or corporate lobbyists. And if we are going to begin to turn the page on this pandemic, people across the country must not have any doubt in this process or in the final product, which is why we need to hear directly and immediately from our public health agencies about how they will prevent political interference and why we need to push for the transparency required to hold this administration accountable. We need the FDA to be transparent by issuing an official guidance with standards for granting any vaccine and emergency use authorization, including standards for the independent review of phase 3 data, by waiting for the completion of phase 3 clinical trials before moving on any candidates, and by committing to make public any data used to greenlight a vaccine. We need transparency from CDC about how it plans to handle distribution, how its experts will drive the process despite the ill-advised decision to have the Department of Defense rather than CDC lead a lot of this effort, and who will get priority when the first doses are available. We also need transparency on Operation Warp Speed's contracts and how it is addressing any potential conflict of interest. In short, we need transparency from top to bottom. And of course, in addition to transparency, we still need a comprehensive national vaccine plan, one of several steps I have called for in the vaccine white paper I put out on vaccine months ago. We have seen with testing how many problems the Trump administration caused by throwing up its hands and refusing to develop a plan and leaving our states to fend for themselves. Testing is an ongoing catastrophe, and we cannot risk a repeat performance when it comes to vaccines. The administration must develop an end-to-end national vaccine plan that addresses how we make sure vaccines are safe and effective, how we produce, distribute, and administer hundreds of millions of doses, how we alleviate rather than deepen the health disparities we know exist, and how we overcome barriers to access like cost and proximity to providers, and how we promote vaccine confidence and fight misinformation, especially when there's so much misinformation coming from the President of the United States. Developing and distributing safe, effective vaccines is a huge undertaking, and one that cannot be accomplished without a strong science-driven leadership from the federal government. So I really am glad we have this opportunity to talk about the important challenges that lie ahead, but there are many more questions we need to answer and so many more witnesses that we do need to hear from. And I will absolutely keep pushing to make that happen. Thank you, Mr. Chairman.